We see patients coming to us and they say that they have a very good control of diabetes for the last so many years, but still they have progression of diabetic retinopathy.
Mm-hmm.
And this is a very important aspect for us to understand, that if you start with diabetes and if you have a duration of more than 15, 20, 25 years of diabetes, your risk of having diabetic retinopathy does go high, even though you have very good control of the disease. This is a long standing damage which affects the blood vessels of the retina and making them leaky, fragile, resulting in downline complications such as bleeding, structural damage, detachments of the retina, and so they can be independent of the level of diabetes. And that's why if you have diabetes, it's really critical for you to have an eye exam. And we stress this at all levels, including
Absolutely.
patients who come at an endocrinology clinic as well.
Can diabetic retinopathy result in glaucoma?
High pressure and diabetic retinopathy go hand in hand, and this usually happens if either of them is not controlled very well. And most commonly, if the diabetic retinopathy is allowed to progress, patients can develop a situation where they have abnormal new blood vessels in the retina, and these blood vessels are fragile and leaky, as I mentioned before, and they can bleed. They can bleed or they can leak fluid, and they can add to the pressure of the eye. And when this happens, it's important for us as clinicians to recognize that the patient has a critical condition which requires an aggressive treatment.
Please be very compliant with your medications and with your follow-up schedule. Missing follow-ups and not being compliant with medications can actually lead to very undesirable effects.